Just waiting for some of our audience. Hi, Shireen. Just waiting for Shireen to join us. While I'm waiting, I can just play with my SkinPen. Hey!
Hello!
Hello! How are you?
I'm fine. How are you doing, Rena? Looking gorgeous.
Very gorgeous as well. Thank you. Really well, thanks.
Thank you.
How's your week been?
It's been good. It's been lovely. I'm back in the clinic, not doing treatments, of course, but it just feels good just to be back in. So,
and I know you've been working really hard. I think have you been doing some new things inside? You're redeveloping or something?
Yeah, we're expanding a little bit, getting ready to reopen, making sure that everything's set up for treatments to go smoothly, taking a lot of inquiries around SkinPen and microneedling.
Oh, wow.
The word is spreading, so yeah, it's going really great.
Oh, and I can see your I never say the name at first. I always say your friend is behind you. So do you want to
My baby.
Your baby? I've got my little beauty to hand.
It's precious.
It's precious. In fact, I was just doing this before you joined.
Absolutely, I need some. I actually need some of myself.
Oh, so do I. Look, I need it on my forehead.
No.
Well, look, thank you. Oh, your baby. Thanks. So, look, people are finding that funny. Guys, we need it. I'll be doing one later.
You don't understand. This is my little baby. Fantastic device.
Shireen, thank you so much for joining us today. You were one of our very first SkinPen customers. We'll come on to that a little bit later, I think. But you've got some amazing case studies, as has Kat Kane at Face Oxford, who we're going to be talking to after this. So the topic that we're going to be discussing today is Fitzpatrick skin types, 1 all the way up to a 6. And SkinPen absolutely is effective with driven results for all 6 Fitzpatrick skin types. I'm probably a Fitzpatrick 3, would you say? Maybe 4?
Yeah.
And I've been having SkinPen since 2018, and you know, it's changed my life, as I always say on most of these Instagram lives. But you've gone a little bit global though with one of your case studies. You're internationally renowned. I think people know you, obviously, and I'm going to showcase it shortly. The case study that we presented, and the Daily Mail had an exclusive on one of your patients. And my American colleagues tell me, I think it just went, well, we know it went global.
Yeah.
But in America, loads of people were just blown away. Shall I pull up the image so people know what we're talking about?
Yes, please.
Okay. So we've got quite a few lovely images. Why don't I show this one? There you go. There's your patient. A lot of people have probably already seen this. They've either seen it on the Daily Mail, or certainly we've showcased it. So this is your patient, which I'd love for you to just talk through. A male, Fitzpatrick skin type 6. Got the chickenpox virus, didn't he? And just going to let you tell everybody. I mean, the results, Shireen, I've told you before, are just phenomenal. They're just incredible. So I'll let you talk about the case study, how it all evolved.
This really was one of the major photos that we did out of many case studies that people were really interested in. It was a young male in his 30s at the time who had contracted the chickenpox virus, and it really left him in quite a dark place in terms of the level of the extent of the scarring. This wasn't someone who had had treatments before or even felt that there was a solution for it. And I think it was dearer to us to want to help, to restore what was their confidence beforehand. And there was a lot of prep that went into achieving that. I always say to people, they often see lots of before and afters online, and they feel that, oh, you know, either it's maybe easily achievable or not. A lot of people were surprised by it. We had to go right the way through consultation, prep, and then the application of treatments over time. But it wasn't easy, and we actually had to wait for the condition to calm down first. So we didn't go straight into treatments at all.
Just amazing. And I know that this gentleman had a course of treatments, didn't he? And under your supervision, of course, you delivered the course of SkinPen microneedling. I'm just going to whiz through some of the other pictures. We have some more photos of this particular gentleman. Do you just want to go into a bit more detail about, obviously we know he had the chicken pox, maybe talk about the depth, maybe talk about how many treatments this gentleman had, a space of how many, obviously life-changing, just phenomenal. But yeah, if you could just give us a bit
even
more
when
detail.
I look at the images, it brings back a lot of memories at the time, and a lot of personal conversation. There were a lot of things to consider. First, I had to understand the skin type of what I was working with. And for most practitioners, I think we feel that we don't want to make a condition worse. Even though a lot of people may look at it and think, well, how worse can it get from there? But when you're working with a darker tone, one of the main obvious things that you can see in this photo right here is the scarring, the hyperpigmentation, and also the pitting of the skin, because it was quite indented. And so there were multiple things that we had to work upon to try and bring that back out. So one of the things we always talk about is the opportunity for collagen induction therapy. Stimulating the skin, kick-starting it. And sometimes you never know what you're going to end up with, because everyone has varying results. But we were quite confident that we could have treated him, as long as, you know, it's as much down to the practitioner as it is to the patient to follow all the set guidelines, all of the set rules. Our treatments were pretty much, I believe the first treatment was 4 weeks apart.
Wow.
The first treatment actually started with just clinical prep. It was just cleansing, toning, preparation, and adjusting what he was doing at home. And then we got him back in about 4.5 weeks later to start the first treatment. We started pretty much, we went straight in at a 0.75.
So straight away, the first treatment was at
straight away
5 mil.
There was no messing about. You know, you can start at your 0.5s. We went straight in at 0.75. We kept the depth. Well, we kept it really. We didn't go too deeply. We didn't press against it. We didn't take it away and go lightly. We actually had to keep that surface at level depth all the way throughout. And the response of the skin was going quite red. If I remember, it was actually coming up quite red. You could see in the undertone of the skin, it was just getting a bit more pink. The after reaction, the patient was fine after the first treatment. A little bit of bleeding went on, but it was pretty much quite straightforward. But the routine was very simple. It was uncomplicated. There wasn't a lot of products. It was really down to the pen.
Really down to the skin. And you mentioned bleeding there. That would have been the pinprick bleeding, which we expect with all patients, just so that we don't confuse the audience. That's not PRP, that's something completely different. And so on the first treatment on this patient, you went in at 0.75, and then throughout his course, did you find that you could go in a lot more deeper into the derma? So maybe at 1 mil, 1.5 mil?
By the second treatment, we had gone up to 1.0, and then on the last treatment we probably stayed around 1.25ish. I would say. We didn't want to go, but it really was the patient's response to the treatment. The needles work so well.
And every patient's different. Every patient's different, aren't they, in their recovery?
And we did quite intricate work. Again, you know, we made sure to not miss edges. We actually delivered on the entire area. We went beneath the eyes, over the nose tips, and it was pretty good, pretty cool.
Well, you can see why this particular case study went global, and you can see why the Daily Mail wanted an exclusive on this, which we're overwhelmed and overjoyed for you and obviously for us at Bioactive. I applaud you. I have applauded you so much. We all do. And I know you've had a lot of people reach out to you applauding you about this particular case study. And how is your patient now? I mean, how is he feeling? Has he come back?
Amazing. I mean, after the first treatment, you saw a difference. After the first treatment, the first clinical response that I saw was the pitting was less. Right. It was less indented. And then I would say between the first and the second treatment, that's when the hyperpigmentation started to lift. Yeah. And you could see more of a clarity in the skin. Aside from those observations, it was really the way that the patient carried themselves. They did not want to leave the house on the first time when how it appeared. Of course. They were shut away for quite some time. I would say almost a couple of months. Wow. In just refined solitude, you know, just didn't want to go out. Yeah. And now, I mean, even though this went global as well, the patient is enjoying that success. They feel pretty confident, and to see the difference in that 1 minute they didn't want to show themselves, to the next they're enjoying all the glory from the newspapers and things like that. It's nice to see.
It is nice to see. Well, look, it's brilliant, and you know, this is very this is just a perfect case study, I think, for anybody who's got those deep, severe scars, whether it's acne scarring or chicken pox, like this patient, or maybe even a burn, but a burn's not going to be too sort of deep, as it were. But this is a perfect case study for anybody out there. Customers of ours who have got patients who come to them and they're just thinking, oh, I don't think I can help. This is great to say, yes, you can. There is preparation. There's a couple of questions, actually, some interesting ones that I'd like to bring to your attention, if I may.
Awesome.
What prep products did you use? We can't actually say what brand, but I'm sure they can contact you directly with regards to that. But what sort of what preparation did you kind of do and get involved in with this particular patient?
To be honest, there wasn't a lot that I could do from the first treatment. I mean, at consultation stage, it was pretty much going through the dotes as opposed to the shoots. The skin was still very inflamed, and I believe it was just at that time water-based, pure, you know, water application, just to gently wipe over to see what I was dealing with. Yeah. And then the prep was pretty straightforward. It was a routine of cleansing, eliminating any alpha hydroxy acids, beta hydroxy acids. We took all of that out. And there was definitely no room for mechanical exfoliation. No scrubs. That was completely out. It was more about the inner prep of trying to get the patient to drink more water, trying to make sure that they stayed hydrated, not smoking, everything pollution based to strengthen the skin prior to the microneedling. Because even though I knew I was going to apply somewhat a normal to lighter depth from the first treatment, I didn't want to go too lightly, if I'm being honest. I wanted to really get in there, and in order to do so, I needed to make sure that we reinforced the strength of the skin before we went forward and done any treatment. So it was pretty much a straightforward cleanse, no toning, and then moisturizing, and definitely SPF. Sun protection factor was applied tremendously every day, and that was the patient's first time being introduced to SPF of any kind.
And clearly taking your direction and your guidance on how they should be looking after their skin. Well, look, again, really, really well done. Thank you. And that's the male Fitzpatrick 6. Anybody wants to kind of ask you further details, they're welcome to get in touch with ourselves or you directly. I know you've always been very, very supportive about the SkinPen, and you've got loads of other great results, of which will nicely lead on to your next case study. So your next case study is a gentleman who is, let me come out of the pictures. So your next case study is a really interesting one. So it's another male, and he is a Fitzpatrick 2. Shall I just show them the picture? Maybe we can talk about it.
Go for it.
Can we do it? Okay, let's show them the picture. So just for the audience, when you see this picture, you might be a little bit alarmed, but don't, because we've got a great story behind this and the reason behind. So let's just show the photograph. So here we have your second case study, a gentleman who is in his, and I couldn't believe it actually when you told me, he's in his late 20s, maybe early 30s, around the 30 mark. The gentleman is a builder who works on the scaffolds. So he's in the sun all the time, has no skin routine, wears 0 SPF. Oh dear, asking for trouble. So he's in the skin all day, no SPF. he came to you with some really major skin concerns, didn't he?
Absolutely.
As you can imagine, being in the sun all day with no SPF, never having a routine, because it's not just women who have a routine, men also need to have a routine. And his concerns were, he looked a lot older than what he was. And I said that to you. I was like, are you sure this gentleman's of the age, with all due respect to him? And wrinkles and fine lines. In particular, we'll show another photograph. He's got a very deep line on his forehead. Do you want to talk to us? And I'll skim through some of the photographs, but would you like to just talk about this gentleman and how you supported him?
Lovely gentleman. One of the first things that were, I mean, it was nice that he came in, he wanted advice, he wanted help. The skin, you could tell a mile off, it was quite thick. He had a thickened epidermis that just was not budging. He had a lot of open pores, central facing, and also a little bit over the forehead. His main concern was that prominent deep line over the forehead, which is one of the things that he wanted to improve upon. And I always say to people, it's not just about looking at the line and then wanting to fix it. There are multiple things on the skin that you need to address, either in sync with, or, you know, alongside with treating the actual concern that they've come in about. And for him, it was undoing several years of damage of complete sun exposure, late night.
As we can see in this picture, because of the peeling. Now, for the audience, and you and I discussed this, that's not the sort of normal peeling patients can experience when they're having the SkinPen. We want them to shed, we want them to have that dry shedding, don't we? But we don't.
It's normally a little dryness, normally dryness or a little tightness, but you don't normally peel to the extent that he did. When he did peel like that, I was actually very happy, because I thought, you know, that's a few layers gone that we need to get rid of. And really, it was more about how quickly his skin was able to turn over. So we were getting some cellular turnover, some fresh skin cells growing through and shedding off, which is what I needed to plan in the next step of treatment. And plus we saw a great difference after just one treatment. We saw that his open pores, the size of the pores had reduced, which meant that we had knitted the skin back together a little bit more smoothly. It was more taut in the right places, and therefore it created a softness in his skin. He always came up this pink. His skin was reactive, and it wasn't on a high setting. We started again quite low, 0.5 to say somewhat patch test, followed by 0.75 to make sure it was safe to go forward with. And we pretty much stayed around that level. The maximum we went up to was 1.0.
Oh, wow. Okay. And that erythema, obviously, you know, coming up, and clearly it's very good. So looking at this photograph here, this is after the procedure, not immediately. I mean, this is clearly about what, up to a week after. And then this photograph is maybe a second treatment, maybe?
This was treatment number 2.
Yeah, because he's also had a course of treatments. And then when we kind of go on to this photograph, you can see in the after image, he just looks a lot more radiant. And you can already see after his treatment, the forehead line has demised. But I remember you saying it was a really, really deep, well, we can see it's a very deep foreline that he's got there. And you were saying, you know, alternative treatments such as a filler would be sometimes somebody's most preferred. Oh, let's go get a filler put in there. But you disagreed, and rightly so. What was your rationale behind that?
You would never truly administer any dermal filler to the forehead area. There's so much risk associated with that. I do fillers as well, and there's so much mapping out and planning that you need to do with very specific face. The most common treatment that people may want to go towards is often Botox, your botulinum toxin. But even with that, we still today, even though toxins and fillers and things are so much more well known, you still have people wanting to shy away from that. They do not necessarily want to try something so invasive at first. And what most patients tell me is that they really just want to preserve what they've already got. which is what SkinPen does.
Yeah.
It's about that cellular turnover, that cellular rejuvenation, that collagen production, and that is what we're all about. And the science behind it just matches up really nicely. He was really pleased with that result. Again, it wasn't one that I had to try too hard about. It's more in the planning than anything else. And the results were immediate. And as the line started to fade, you also saw a softness in his face.
You can see kind of here as well. You can see, and certainly the softening in his face in this particular photograph, I feel. So there was an array of things that SkinPen Precision supported this patient with. Not only was it obviously his overall skin, not doing any regime or any routine, but the rosacea, the sensitivity you were saying, he also had some sensitivity as well. And is that because of the exposure to the sun with no SPF?
Absolutely. We had to prep. So again, the prep during consultation was to tell him all the things he needed to do before the first treatment went ahead. We don't normally administer a treatment straight away. We actually do quite an in-depth consultation prior to the treatments taking place. That is also to sort of test how well you can look after your skin, because we find if patients can't do the basic of what we ask, then they're not going to see the results once they start a course of SkinPen treatments.
And I know with you, Shireen, you are very, very precise and particular when it comes to your consultations. You're an absolute avid professional. You like to get involved with your patient in the sense of you really want to know about them. You want to have a connection with them so that you can understand. When I was kind of asking you those questions, you know, how do you do your consultations? You were just, it was very clear. You were just like, I need to connect with them. I need to understand what it is that's bothering them, what it is that they need to, what they want to achieve. But more importantly, they might come in and say to you, I want this treatment, and it could be an expensive one. But you don't go ahead with it, do you? You have, I'll let you tell everybody, you have the consultation, and then you're like, actually, this is the best treatment for you. So do you just want to go into a bit of detail about the consultations, please?
I like to look at everything from a client's perspective and also that of a practitioner as well. And for any practitioners that are watching today, they will know that people come to them and they want to look like this, and then there's the reality. So we have this, and then there's the reality, and we need to see if that can be achieved, but through safety. You know, it's not for a monetary gain. We need to make sure that the treatment is safe to be administered first of all, and to see what realistic goals can actually be achieved. And that is what we always talk about first of all. Lifestyle plays quite a big part in that as well. As you mentioned, he is a builder, scaffolder. You know, there was no way that I would even have accepted him as a patient if he was not willing to use SPF. And so on that basis, I would have had to either say, you know, I'm sorry, I can't treat you on this one, or this is an alternative treatment to have. And with him, what was quite close to me with this case is that he had gone elsewhere and tried other things. And a lot of people were telling him just to simply have microdermabrasion, which was clearly just not working. I liked microdermabrasion as well, but it just was not working in this case. He was not seeing the results that he wanted. And I don't like to waste people's time or money. I like to get to the result as safely and quickly as possible. And I made that quite clear in the consultation to him as well.
Well, he must also be over the moon, just as your first patient. He must absolutely be over the moon. He's now using SPF. I hope he's wearing a hat as well.
Absolutely. Again, that was difficult to plan his treatment plan out. He was wearing, you know, the safety helmets, the builder's hats. And so we had to time treatments to coordinate with when he was not going to be at work. And not have the friction of the builder's hat as well. And of course, you want to attain long-term results as well. It wasn't just him coming in and having this treatment and then expecting the line to just be diminished. It was maintenance, but trying to aim for a long-term result and not just a quick fix.
Yeah, absolutely.
So that was fun.
Well, again, your second case study, I applaud you. Absolutely great work. You know, it's your patients must be over the moon, and I can't help but always keep going back to this one. This is my my personal favorite, just because I do know of people who have had chickenpox. I know I keep going back, you know, they've had chickenpox, they're not quite sure what to do, they think there isn't an alternative treatment, they don't know there's a treatment out there that's going to be able to go deep into the dermis to support the rejuvenation of the scar tissue, in order to replenish and start, you know, having those new baby collagen being prepped and prepared and growing, etc. So look, well done. Thank you very, very much.
Yeah.
So just before you go, because I've got to welcome my wonderful second customer onto the live today. Why did you go with SkinPen Precision, and what's been the best thing about it for you?
It was a no-brainer. I don't even have to think about it. I could have went with any device. I actually had to save up before I purchased my first SkinPen. I had done a lot of research into it, and it was at the time I remember just reading so much about the healthy aspect of it. So what got me, aside from marketing and things like that, it was the safety lock feature of the device. Not knowing what practitioners to trust or where to go to and what places are clean and what are not, I enjoyed knowing that the safety lockout feature, which the pen has, you could attach it and it could not be reattached for use with another person's skin. So therefore preventing things like cross-contamination. Aside from the health and safety, it had to be the precise precision of those Japanese needles.
Yeah, I agree. I absolutely agree.
The precision. I actually watched a seminar on how they were sharpened and put together and how they entered the skin upon entry. And that for me was just like a laser. It was just so sharp, so defined. It wasn't going to create any rips or tears in my client's skin. So that was... And of course, the fabulous team behind SkinPen.
Yeah, and also the fact that, well, we try our best, but we're only as good. We at Bioactive Aesthetics, you know, as you know, we are the UK distributors of the SkinPen brand. We are only as good as our customers, you know, and we've got some amazing customers. So, you know, thank you to all of our customers. But I'm really glad you did go with it, because we wouldn't have seen some of your wonderful work. And like I said, you're a bit of a celebrity now. You've gone global.
Ooh.
Yeah. Oh.
Thank you. I do get a few messages, quite a few, so I'm sorry if I haven't responded to everybody. And everyone just can't wait till we open now. So everyone's saying, when can I come in and have a treatment? Which
well,
is
you've
great.
got a waiting list, haven't you? You've got probably about 20 or 30 people waiting to have the SkinPen treatment. So...
I normally have a waiting list of about 3 months. My clients will verify that, 3 to 4 months in some cases. So we're just going to try and get people in safely and steadily when it's safe to do so.
Yeah. So thank you. If you get your device to hand, we've got a strap line this year at Bioactive Aesthetics for the device. Is so SkinPen Precision is the best decision for a safe incision. Shireen, it's been a pleasure. Thank you so much, and I'll catch up with you again soon.
Oh, thank you, Rena. Thank you.
Take care. Bye.
Bye.
Well, I hope everybody enjoyed those 2 case studies that we've just showcased. I hope you all agree. Some fantastic case studies there. So I'm just going to invite our second guest now, which is the wonderful Kat Kane at Face Oxford. Just going to find Kat now through my list. Just waiting for Kat to connect. Hi.
Hello. Hi.
How are you?
I've just really enjoyed watching that.
Oh, wonderful, wonderful. Well, I'm sure the rest of our audience are going to look forward to all your case studies now as well. Brilliant. Well, look, thank you.
Hi, everybody.
Kat, thank you so much for joining us today. We really appreciate it. You've also got some amazing case studies that we're going to showcase to all our audience today. But before I do that, let's make a lovely introduction. So you are a nurse practitioner. You've been a nurse practitioner for 17 years now, and your clinic is based in Oxford. Of course, it's called Face Oxford. And you've also, like I've said, got some amazing case studies. I think you posted one a couple of weeks ago, and I think Instagram just blew up because I reposted it. It was great to see other people reposting it. And thank you to everybody who accredited Kat with that case study. Actually, maybe we should show them, right, what we're talking about.
Yeah, absolutely.
Should we just get into it?
Can't wait to see it again.
Let's get into it. So this is a lovely young lady called Lucy. Oh, I'm in the way. Let me see if I can flip it. No. Can you see that before and after? I hope everyone can see.
I can see it just about. You're kind of a little bit over it, but yeah, it's okay. She's gorgeous. Let me tell you all that.
She is a lovely lady, isn't she? And the well, they can see some of the skin, can't they? So this is a lovely young lady who came to see you, lost her confidence. She had acne scarring, right? And you know, I know that you're very, very passionate about skin health and making people feel amazing about themselves. Why don't you tell everybody about this lovely case study and this lovely young lady and what her concerns were, how many, she had a course, how many treatments, and the depths that you went into, please?
Sure. Okay. So the lovely Lucy came to visit me end of last year. I think it was October, and we had a little bit of a chat. And as Shireen quite rightly said, a huge impetus is on the consultation stage and chatting through what people want and what they would like to achieve from the from the treatment, and discussing which treatment's going to be the right one. And for Lucy, there really was no other doubt in my mind about what would be the best for her.
Kat,
Kat, yep.
Do you want to just bring your camera down so I can see? Perfect. I could only see your nose. Yep. Perfect. Oh, thank you. Thank you.
I can see my full face, so that's
Can everybody else see Kat? Can someone give us a thumbs up if they can see Kat's face? I want to make sure the audience can see you. Okay.
Is that better for you, at least?
Yeah, I can see you perfectly. Okay. But the audience, make sure that you're. Thank you, Kat. So, sorry, you were saying.
Yeah, no, perfect. I can see lots of thumbs up there. Thanks, everybody. That's brilliant. So yes, so Lucy came to see me. She talked to me a lot about, lack of confidence. She didn't want to leave the house without wearing makeup, and definitely felt conscious of her skin. And I think actually, I mean, acne is something that I love treating anyway, whether it's active acne and the skin health and stuff, or moving through to helping people with their acne scarring. And I think it's such a common condition, so many people suffer with it. And actually, there are treatments out there that can be really, really effective. And for the acne scarring, I had some wonderful results, not only with the case studies that we'll talk about today, but also with other people as well. She came to see me. She had a course of 3 treatments between October and December last year. And I think one of the photographs that you've got is just after the first session. And we could clearly see there was a great result after just that first session, really.
Yeah, this one's after 2 sessions. Hopefully people can see that a little bit better.
Yeah, that's right. Yeah. And I think, you know, she'd started talking at that second session about how her confidence had gone up and stuff. And actually that just grew every time I saw her. And you could see it on her face. It was lovely. Such a privilege and a pleasure to have been able to help her. Really, really lovely. So in terms of the treatment, the thing I love about SkinPen is really that, you know, there is no need for any particular prep as such. So, you know, some people you may want to think, if we know that they're particularly at risk of pigmentation, some higher Fitzpatrick scales, you might want to pre-treat with something. But for Lucy, we didn't really have to do any of that. She did already use SPF, so I knew that that was something that she was gonna carry on with, and had a pretty good skincare regime anyway. So in terms of the treatment itself, the depths that we went, after my fantastic training with Heidi, I know that what we're looking for is this erythema, because we're looking to show that we've caused this inflammatory and this inflammatory cascade to start. This erythema is what we're looking for. So with Lucy, I varied it across her face, and I went over her full face first, and so, you know, varying depths, and it was according to the results that I was seeing, and the redness that was coming up, and also how comfortable it was for her. And she was very comfortable, so that was fine. So actually, right from the first treatment, I think we went, you know, the maximum I went on her face, on her cheeks, which is sort of the deepest area, was about 1 millimetre. And then at the end of the treatment, what I always do with my acne scar patients, I then go over the acne scars at a slightly deeper depth. So I went at 1.5 and did what we call the stamp method. And I've got my pen here as well.
You beat me to it. I was going to ask you about your pen. Yeah.
Just to demonstrate. So basically pulling the skin really, really taut and then just doing like a stamp method here. And what that really enables me to do is to get down into the depth of those sort of the deeper scars, so that I'm not only treating the sort of surface, but I'm actually able to get down and really get to the bottom of those scars and help with that bioremodeling of the skin. So yeah, that's what we did with Lucy. So she had her 3 sessions and was absolutely delighted.
Yeah, and this photograph here, I mean, I can see, I mean, anybody would be delighted. It's just a shame the picture I'm kind of covering, but it is on your Instagram. It is on our Instagram for people to see. It's actually one of our most viewed posts ever, and I think you were saying the same. This photograph. So the image on the image on the right hand side, Lucy sent you that 6 months after her 3rd treatment. Is that right?
So so this one might have been slightly before. I think the 6-month one is the full face one that we've got.
Okay.
But yeah, this is one that she had sent me probably about 4 months after we started the treatment. So because I hadn't seen her for a while, she sent me an update. It was great. So, and she's been lovely about keeping me in touch. We've kept in touch about a few things, and she's always messaging me and vice versa. So it's really nice.
Well, you can see why, Kat. Absolutely phenomenal, and I applaud you. You absolutely are brilliant in achieving these results for your patient. And you know, a lot, again, it's what I was saying earlier with Shireen. You know, there's a lot of people out there. Of course, she's a Fitzpatrick skin type 1. We can see that. It doesn't matter if you're a Fitzpatrick 1, a 4 like me, or even a 6. SkinPen Precision works really well, and the clinical trials that the device, you know, obviously, as everyone knows, it's FDA cleared. It took 3.5 years to get the clearance. Clinical trials on acne scarring, and look at the results you can achieve, and they are life-changing. She must be over the moon, and I think
I'm delighted. I'm really delighted.
We do say to our customers, you know, if you've got those deep acne scars, you can go deep into the dermis. We recommend, and I'm quoting one of our lead therapists, Sue Shaw, who's also done a lot of lives with me. I'm sure Sue said 1.25 up to 1.5, but no more, getting into the dermis.
Yeah.
It's just brilliant. Which leads me on very nicely onto the next case study of yours. Where's the picture? Here. So this is a patient. Again, I'm in the way. I hope I hope the audience can still see that. This is also on your Instagram page. This lady is a Fitzpatrick.
If it's to me, you can see the results on her cheeks.
Yeah.
So you can see it. Yeah.
Please tell everybody the wonderful, you know, case study about this patient.
So actually, Sophia, again, another lovely client. I'm so lucky to have met so many wonderful people, and I've seen some of them popping up on here, so hello to everybody. So yeah, Sophia, another young lady in her 20s who came in, actually she came in for double filler treatment, and we got starting to talk about her skin, and again a very similar thing in terms of, you know, how it affected the way she felt about herself and the way that she would or wouldn't want to wear makeup and things, you know, and wouldn't be able to or feel comfortable going out without makeup. So, so actually, whilst we were talking about her, she came in for a consultation for her filler, and whilst we were doing that, we then started talking about her skin, and it kind of led from them. And actually, before she had her filler with me, she came in and had her microneedling sessions, and so she came and again had a course of 3 sessions and has had a top up as well since then. You know, again, really similar thing with her in terms of the depths that I went. I think looking back through my notes, perhaps that first treatment, I think it was a little bit lower, perhaps 0.75 on the cheek at the maximum, and then obviously varying depths and lower over the bonier areas and the thinner areas to start with, and then we built that up as she went along. And I did exactly the same thing with her that I did with Lucy, which was I always treat the full face first, and then I go back and really concentrate on those acne scarring. So I know that she's had a great treatment with me, but by the end of the time that she leaves.
Well, the results are amazing. You can really see again, like you did with Lucy. And again, I applaud you again. Some really great case studies. And, what I really love about you ladies and about a lot of our customers is you're very passionate. You're very passionate about your customers. And I know you also are very, very passionate. You really take your time. You were telling me this morning, you've got, is it over 30 people waiting to have SkinPen? And these aren't people who are on a course of treatments with you. Yeah. These are new customers because you're very active on social media. I love it when you tag us in. I see everything, by the way, guys. Every tags, every, comments, I see everything. So thank you to everyone. But you're really, really good with your social media. Do you think that's led to the success of those 30 treatments that you've got on a waiting list? Looking at these results, I mean, I can see why, but do you think?
Yeah. I think it's actually, I've seen somebody who helps me with my social media has just commented a second ago. So hello, Lloyd. So yeah, I think that's hugely important. It's really important for people to see you. It's really important for people to get to know me. And I think sometimes people come in and we immediately, they chat, they feel like they know me, they've seen stuff, and sometimes it's just stupid stuff like I posted earlier on today and I've got the kids in the background, or stuff like that, but they feel like they know me. And I think it's building that trust, that they know that also I'm choosing products, treatments, services that are going to really get the results. I put a lot of time and effort into doing that, and yeah, I think social media is it's a really great way to sort of hear about other treatments, to see people's results. I mean, certainly when you get results like these that I've been lucky enough to have with these ladies, that's certainly, I think people see that and they see it, and they see it the next time you post, and suddenly they think, actually, that's really achievable. It's not, it's something that can happen for me. And I think that's wonderful. It's really, it's very important. Yeah,
it is really important. And well, look, thank you for those 2 case studies. We've got one more picture which we weren't going to include it, but I really wanted to include it. It's not necessarily, well, it is a case study. It is a case study. So without further ado, I think I'm just going to go to the picture.
Yeah.
This particular case study is of our wonderful cat. So it's you. There you are. I mean, all I'm going to say, and I hope the audience will send some comments of, wow, look at that transformation. Just unbelievable. And I remember when you posted this, I think you tagged me in actually. And I was just like, unbelievable. Wow, what have you done, to etc. So if we bring the audience up to speed, the picture of you on the right hand side is back in 2018. Now, you were a lady who did nothing. You had no skin routine.
Yes.
You absolutely enjoyed tanning beds, didn't you?
Yes.
So you love tanning beds, and you used to use face wipes to remove your makeup. No judgment here, okay? I remember you wrote that in your post. Don't judge me.
I did.
Nobody's judging you. I used to be one of those as well. Please, in my 30s, we've all been there. And sometimes you might not take all your makeup off, and so you loved the tanning beds. You didn't have a regime, and then you thought, no, enough is enough. I'm going to change my skin routine, and I'm going to invest in a multitude of different treatments, so combination therapies, of course, which SkinPen was one of them. Why don't you tell our audience a little bit about what this picture means to you, and the sorts of treatment plan that you underwent for yourself?
I think this is a great one because for me, this hopefully should give hope to everybody. So in this photo on the right hand side, I was 38 years old, never done a thing really with my skin. I'd cruised on the fact that I'd always been very lucky and had fairly good skin. I tanned, used sunbeds, etc., as you said, and at that point I had two very little children, and you know, routine for me just wasn't there. It really wasn't there. And I was becoming more and more interested in aesthetics, and then eventually sort of came into this area. And as I did, I then started to up my game, and I was like, oh, actually I can see some signs of aging. I have to say my wrinkles, forehead wrinkles, you can't see it really in these pictures, but were quite bad actually. And I was thinking, oh, you know, maybe I'm going to have to start some Botox, maybe I'm going to have to start some of these sorts of things. I have to say I haven't done any of that. Wow. I haven't done any of that. Great skincare, and yes, it has been a multimodal thing in terms of I've used good skincare at home, I've had some peels, but I have to say microneedling has been a game changer, absolute game changer, really, really hugely. And I really think that that's been a massive help to my lines and wrinkles. And I think I look younger now than I did then. I mean, you know, so it's very emotive looking at that, because actually looking at it now, I think, you know, if I hadn't started that back then, where would I be now? And I think, you know, that's a great impetus hopefully for other people to say it's never too late to get going. It's never too late to invest in yourself, you know, to get that stuff going. And I think, you know, hopefully that will inspire a few other people to take that plunge.
Absolutely. I mean, you look great, and you did a mixture of things. I know you did SkinPen. You did chemical peels. Did you also do PRP on this one as well? With using the SkinPen device?
Yes. One of my sessions was PRP, and I do that in clinical. Because actually, one of the things I haven't mentioned, or I don't think we've mentioned so far on this, is actually the great results that you can get with it for hair loss. And I find it was really quite, you know, after having kids and it's all falling out. So it's actually really, really helped with a little bit of hair growth. I used it with my husband as well, on his head as well. And, you know, I think great results can be had with combining things, but also you've got to be aware that, I mean, that's a couple of years of progress. So, you know, if you want to get those really, really good results, especially things like pigmentation, it takes a little bit of time.
Yeah. Well, it's a great case study, even if it is about yourself. And I know it's not just SkinPen, whereas the other case studies have all been SkinPen Precision, and it's been very specific on a course of treatments. And you're also another practitioner who's very big on a course of treatments. It's just not a one-hit wonder. You know, even we get people asking us, can I just have one treatment? Is this a facial? One, it's not a facial. Two, you know, you'll have to speak to your practitioner. We don't advise that you just have the one treatment. You do need to invest. The thing with SkinPen, and we talked about this, is SkinPen slows down the aging process, whereas things like Botox and fillers are quick fixes. And you can actually have SkinPen alongside Botox, can't you? And alongside
will do that. Yeah.
Absolutely. And you'll put packages together. I
think certainly as well during lockdown, I think people have been much more invested and interested in skin, and I've had a lot of consultations, and I also now have a lot of consultations with people who are perhaps interested in Botox. And quite often what I'll say to them is, well, yes, okay, but before you get to that step, why don't we try something else, something that's going to help your skin health, you know, it's going to last longer. And this is certainly one of the things, you know, that I come back to time again.
Well, you look great. Now I've got a little Brucey bonus actually, and it's a picture of me. So I had a couple of people who were saying, oh, Rena, you know, you often talk about yourself, you know, you had treatments and you used to be an acne sufferer and so I'm just going to put a picture, just a quick, I don't even think my boss has seen this either, so it'll be a nice little surprise for Kathy. It's because I'm a Fitzpatrick skin type. Would you say I'm probably a 4, right? 3, 4? Probably a 4, I'd say. I don't know if anyone can see that, but I'm in the way again. So you probably can't see the scarring so bad on me, but I'm a Fitzpatrick 4. I had I don't know really what they are. I tried laser, I tried topical treatments, and you can see that the texture of my skin has changed. If you look at my jawline on the right hand side of the picture, there's no filter on them. I absolutely promise you, there's no filter on there at all. But the texture, so it's not just the clearing of the face, it's also a case of the tightening, and it can sometimes change your the what's the word I'm looking for? The shape of your the jawline, the shape of your face. Whereas, you know, I've made it
tighten that area, can't it?
It tightens. So I've been doing SkinPen since probably 2018. I've 18 months now, and I've never looked back. I don't do Botox, I don't do filler, but I do SkinPen, and I do it from a skin rejuvenation, anti-aging. It eradicated all my acne. You can't even see on that picture where my acne scars and things are really, but I just wanted to showcase a different Fitzpatrick skin type, as it were.
Definitely see the improvement in the skin tone and the
well, I've taken it off now. I don't want that picture.
Amazing. Oh no, it's lovely.
You're
That's
much
really
more
nice.
beautiful. You're much more beautiful.
God,
so we'll go back to you. Well, look, you've been amazing, and again, you know, your case studies are brilliant. I think what I'd really love to find out a little bit more, as I'm sure our audience would do, is why did you choose SkinPen, and you know, how has it, obviously the case studies we know, but why did you choose SkinPen, and what would be your advice to somebody who might be looking to invest in the SkinPen? What would be your sorts of words of wisdom to them?
I think Shireen summed it up earlier when she said it was a no-brainer. As I say, I do a lot of research. So I researched the treatment itself. I looked at all the different studies. I looked at then different devices when I knew that microneedling was something that I wanted to do. And SkinPen is head and shoulders above the rest. It really is. There's just no, we've talked about it already in terms of the FDA safety, the clinical evidence that's behind it. For me, I really worried when I was doing microneedling devices before about the cross-contamination issue, and I know that I don't have to worry about that with my patients. So important. Of course, the results speak for themselves. I think the other thing is that it is safe for all skin types, skin colours. You know, there are certain people, perhaps an active rosacea, you'd have to be really careful and treat that, you know, carefully and think about it differently before you needle them. But I think those few things are so important. You know, and then actually the big thing is the support for me as a practitioner, especially when you're coming into this and you don't exactly know what to do, how to do it. The training, the face-to-face training was brilliant. Absolutely love Heidi, and she gave us her telephone number afterwards and said, look, if you want to contact me about anything, you know, give me a shout. And I have done a couple of times. I've been like, oh, I've got this case, you know, what would you do for best? Actually, stretch marks. I got in touch with her about treating a lady with stretch marks because I'd never done that before. So the training is fantastic, the support is fantastic, the marketing is another thing. There's the Dropbox file, which is absolutely fantastic. There's all sorts of things that you can use within your social media, and for me that's a big thing about how to get it across, especially at the beginning when you're starting out. You don't have all the before and afters. The social media, in terms of, you said earlier, you guys repost everything I do, you tag everything, and that's wonderful. It means that, you know, it's really nice to know that you guys are there. And again, I messaged you before and said, oh, you know, what's this, or how's this going, what's happening with this, and you guys get back to me. So you've been absolutely amazing. And there's also the fun side of things. I love some of your fun, you know, the videos that that we did together just recently, and then the one of Halloween last year. So yeah, I think the whole package, for me, the biggest thing has to be patient safety and the results. But the fact that it came with this whole package, and I can see loads of people, I'm sorry, I haven't really been looking at the comments, but loads of people have been sort of smiling and love, you know, sending love hearts. So I know that that's felt through everybody. So thank you guys very much.
Well, listen, thank you very, very much. We really appreciate you, and keep going. We wish you all the success when you reopen your clinic, as to every one of our customers, and then anybody who's not a customer and you're watching, good luck when you reopen. Kat, you've been amazing. I'll catch up with you shortly if not tomorrow. But thanks so much for being our guest today, and well done on it all. Take care.
I've loved it. It's been brilliant.
Bye, everyone.
Thank you very much. Bye.
Oh,
bye.
See you. Bye.